I'm Marc Fowler, founder of Bullseye Media, and my expert tip is about branding a dental sleep medicine practice. If you're serious about developing a sleep practice, you need to position yourself as an expert in the minds of prospective patients. And in order to do that effectively, I'm convinced that you need a separate brand identity for sleep. And there are a few reasons for that. First, you want patients that come in to see you to be in a medical rather than a dental mindset. And if you think about, you're going to be talking about treating a medical condition, billing medical insurance, and if you consider the typical interaction between a patient and a physician, doctor walks in, asks a few questions, quick exam, and they're writing out instructions. I want you to take 20 milligrams of this twice a day, have these tests done at this lab, and be back to see me in 2 weeks. And what do most people do? They do exactly as instructed. And that's the mindset you want them in when they come to see you. Also, your website needs to effectively instill confidence and position you as an authority on the topic. And if your website is trying to be all things to all people, it can actually have the opposite effect. If someone's searching online for sleep apnea treatment and they come to your website and they're on your services page, along with sleep apnea, they see dental implants and teeth whitening and root canals and crowns and the list goes on, they're likely to have one of two responses. Either they'll be thinking, how can they possibly have expertise in sleep apnea and all of these other dental services that are so unrelated to sleep apnea, the jack of all trades concept? Or they will just have a difficult time making the mental connection between sleep apnea and dental services. Last summer I was at the AADSM national meeting and I got home and my father-in-law was at our house and he said, "Hey, where have you been?" And I said, "Well, I was at a dental sleep medicine conference." And he said, "You mean like laughing gas?" And I said, "Oh, no, this is a group of dentists who treat sleep apnea." He got a confused look and thought for a minute and said, "How in the world do dentists treat sleep apnea?" And that's a very common response. And until you're able to explain to them and show them how oral appliance therapy can effectively treat sleep apnea, very few people are going to be able to make that connection between a dentist and sleep apnea treatment. And it's for these reasons that you need a separate standalone brand identity, totally separate from your dental practice. And that's everything from a name, a logo, a website, as well as supporting assets such as a Facebook page and a YouTube channel. And if you'd like to learn more about this topic and this idea, you can check out the blog at dentalsleepmarketing.com.